Now we are going to look for a metabolic cataract. As we already looked, if you have not watched my previous video, then you have to look it first, because we are discussing the acquired cataract, in which we first talked about the nuclear and the cortical cataract, which is comes in acquired type. Next, we are going to talk about the metabolic cataract, like what are the metabolic diseases because of which the cataract is being there. So first is the diabetes mellitus. They can be also hypocalcemia, and they can be a galactosemia. They can be many other reasons. So first we will look for the diabetes mellitus, causes senile cataract at an early age. Next, what is present in it? Diabetes mellitus patient shows a typical morphology of a snowflake or the snowstorm cataract. Like the lens is look like a snowstorm or the snowflakes. Increased glucose lead to sorbitol pathway due to saturation of other metabolic pathway like the glycolysis and the Krebs cycle. When enzyme hexokinase is saturated or inhibited, sorbitol pathway is the only pathway remaining for glucose metabolism. Sorbitol accumulation in the lens due to aldose reductase pathway leading to overhydration of lens causing cataract. Next, may be a reason for galactosemia. Deficiency of GPUT, galactose phosphoruridyl transferase, causes oil droplet cataract. So, what is the characteristic feature for the galactosemia? It causes oil droplet cataract. And deficiency, what is the deficiency of the enzyme? Known is a galactokinase causes lamellar cataract. Deficiency of galactokinase causes lamellar cataract. So next, hypocalcemia due to decrease parathyroid activity, that is hypothyroidism. It could be a reason for a cataract, metabolic cataract. Next is a Wilson. Wilson, you already know that the copper accumulation. Wilson disease, hepatolenticular degeneration is a rare condition caused by deficiency of alpha-2 globulin and ceruloplasmin. So they are the two things which are missing in a Wilson disease. What are they? They are alpha-2 globulins and ceruloplasmin. It is characterized by a widespread deposition of copper in the tissue and become manifest in three ways. So what are the manifestation of blue Wilson disease? So they are the liver disease, neurological involvement of the basal ganglia, and psychiatric feature. And there may be ocular feature. What are involved? Sunflower cataract is seen. Your Viva teachers may ask, sunflower cataract is seen in which? Wilson disease. Next, KF ring. इसको बोलते हैं केसर फ्लैशर रिंग. तो it is golden brown discoloration होता है. So it has a golden brown discoloration of Descemet membrane. Is due to copper deposition and is pathognomic of Wilson disease. Next, Fleischer ring is iron deposition. If there is a iron deposition, it is known as Fleischer ring, and if it is a copper deposition, then it is known as Fleischer ring. Fleischer ring. Next, Loeys syndrome. Loeys syndrome comes under a metabolic cataract. It is an inborn error of amino acid metabolism. What are the ocular features for it? Congenital cataract. There is a inborn error. There is congenital cataract. Microphakia it means lens gets small or constricted. Posterior lentiglobus, posterior lenticonus. Lenticonus it means the lens gets shape of cone. Lens gets a shape of cone. Next, glaucoma. Ocular feature. Glaucoma may be seen congenital cataract, microphakia, posterior lentiglobus, posterior lenticonus. Next is the monocytosis due to deficiency of the alpha monosidase leads to mannose-rich oligosaccharide in tissue, causing spoke-like posterior capsular cataract. Next, Fabry disease. It is due to the deficiency of the alpha galactosidase. Or what are the ocular features? The patient may present with a spoke-like cataract, no impairment of vision. There is no effect on vision. Next is the vertex keratopathy. So if there is a patient of the Fabry disease, it will be presented the OPD with the spoke-like cataract and the vertex keratopathy. Next, third will be complicated cataract. Comes under types of cataract we are discussing, like the acquired one. So we will look in the next video.